Facilities that make this program possible are provided by the City of Highland Park. Programs are produced independently by members of the community. The City of Highland Park is not affiliated with the following program or the producers of public access programming and is not responsible for the content. The following program does not reflect the opinions of the City of Highland Park.
And welcome to our very first new show. It's called The View from Highland Park. I'm Dr. Suzanne Conman, and I want to introduce our view group today, which is
Pam Chill. I'm host of Chill Out, so you might have recognized me.
I'm Joyce Bernstein, and I'm the host of 30 Minutes with Joyce.
And today we're going to talk about, from a woman's point of view, about abortion. Should it be legal, illegal, the pros and cons of abortion. And I like to talk just a few seconds, and then we'll open it up to the rest of the crew here. The debate over whether or not abortion should be legal or should be a legal option continues to divide Americans long after the U.S. Supreme Court the 7-2 decision on Roe versus Wade declared the procedure a fundamental right on January 22nd, 1973. Proponents identifying themselves as pro-choice contend that choosing abortion is a woman's right that should not be limited by government or religious authority, and which outweighs any right claim for an embryo or fetus. They say that a pregnant woman will resort to unsafe legal abortions if there is no legal options. Opponents, identifying as pro-life, contend that individual human life begins at fertilization, and therefore abortion is the immoral killing of an innocent human being. They say abortion inflicts suffering on the unborn child, that is unfair to allow abortion when couples who cannot biologically conceive are waiting to adopt. So we're going to open this up to discussion with both Pam and Joyce, and we're going to talk about the U.S. Supreme Court's decision. Is it a right or isn't it a right? Is abortion murder? It's reproductive choice empowers women, giving them control over their own bodies? Or does life begin at conception? And so unborn babies are human beings with a right to life. Well, girls, we have a big discussion ahead of us.
Thank you. Yes, we do, and this topic has come around again. I remember when I was very young and it came around the first time, and now it's come around again. Just wanted to add some women's freedom to choose is protected by the 14th Amendment. Webster, 1989, the court upheld some restrictions on abortions, and the Casey decision in 1992 does not overturn Roe, but permits more restrictions. 24-hour waiting period, parental consent, pamphlets about alternatives given to those considering abortion.
Mm-hmm. And Joyce, what do you feel about?
Well, I think it's up to a woman to decide for herself. And I don't believe the baby is already alive or born or something at a conception, because you certainly couldn't take the baby out and it wouldn't live if they took it out of mother's stomach. And I wanted to read what Governor Pritzker has decided. It says, late Friday, the Senate voted 34-20 to send Pritzker a sweeping abortions rights bill previously passed by the House amid an increased sense of urgency among proponents to pass a law to protect access to the procedure, as other states have passed laws essentially banning the practice. Then he goes on to say, the health of pregnant patient must be paramount, said sponsoring Senator Melinda Bush D. of Grays Lake. The bill establishes the fundamental right of a woman to have an abortion and states that a fertilized egg, embryo, or fetus does not have independent rights. It repeals the Illinois abortion law of 1975, doing away with provisions for spousal consent, waiting periods, criminal penalties for physicians to perform abortions and other restrictions on facilities where abortions are performed.
You know, as a psychologist, I have treated women that have had abortions, and there are a lot of different, what happens is something that isn't talked about in a lot of these clinics, what happens to a woman after the abortion. And there's a post-abortion syndrome that does many times occur in women. Reoccurring dreams of the abortion experience, avoiding of emotional attachment, relationship problems, sleep disturbances, guilt disturbances about surviving. If there's memory impairment, hostile outbursts, sometimes suicidal thoughts or actions, depression, substance abuse, anxiety, and a lot of times the anniversary syndrome that does occur. So there's a lot of abortion syndromes, and I have treated women that a lot of times cannot get pregnant after abortion, and there's so much guilt surrounding the abortion, which somehow Pam, I don't know why, but a lot of times this is not discussed in an abortion clinic or pre-abortions. They don't talk about it with the person. They just take them right away, and they have their abortion without describing some of the post-abortion syndromes that go along with abortion. What are your feelings about that?
Well, I don't know exactly what they say or do not say in the clinic, when they are doing that. My feeling is that everybody should be well informed. And I do believe in a waiting period. I don't believe it's a decision. I think you should gather all the information that you can, and then you should come back 24 hours. So I'm in the restrictive way of doing an abortion, that you should really understand all your options. May it be adoption, may it be being a surrogate, may it be obviously having an abortion. And if you're going to discuss it with a family member or a counselor or a religious person, that you should discuss it and then make your decision.
Yeah, I think that if we're hearing so many cases of post-abortion syndrome, obviously they're not getting that quality information at these clinics, because otherwise people would be well informed ahead of time about an abortion. Your thoughts about it, Joyce?
Well, first of all, as far as that goes, many women have postpartum depression, and that's after having a baby. And also, when women have miscarriages, they also have depression, very bad depression often. So I don't think that that's the only reason for the depression and all of that. So it could happen under other circumstances too.
I agree with you on that. But an abortion, that is, they're choosing to not have the baby under a miscarriage. You don't know that ahead of time, because a miscarriage will happen, without, there's no consent. It just happens. The miscarriage, it isn't a miscarriage that the doctors are, you're not getting you're not going in for a miscarriage. And after the baby, I agree, 9 months, they need to talk to patients about, if there is a problem after your baby and you start feeling depressed, these are the things you need to do, or consult a therapist right away. Sometimes you're not getting the full picture. Doctors, and nowadays there's so many cases that they have to do, and they're pressured to do so many things that they need to talk to the person either having the miscarriage or having the baby or choosing to abort. There needs to be some kind of counseling ahead of time of what can happen. And I don't think many women are getting this. And also, what about the, I know you did some little bit of research on the morning after pill.
Right.
That's another option, that you don't have to wait for months and then decide, yes, I'll keep the baby, no, I'm going to have an abortion. you could decide right away the next day.
Right. The abortion pill it's commonly used to end a pregnancy, and it can be used up to right about 70 days of the initial conception, that period. And it is by prescription. If I'm misinformed for any state, just please let me know.
I think there's some of them you don't have to. They're on the market. You don't have. There's only one that I saw that you have to prescribe to a medicine, but the rest are you can get them over the counter.
You can get them over the counter now.
Yes,
Okay,
yes.
so that has changed.
So, in other words, you're saying that by having an abortion and people feel guilty, like they killed someone, would it go that far?
No, but I think a morning after pill, you wouldn't have these feelings. You would.
Yeah, but you would still be making sure
that you don't have any children at that point.
yeah.
But it's just one day after the sexual experience that you.
Right.
Yeah.
still
But I do
stopping
want to
the
interject. I mean,
baby.
if women have taken a pregnancy test and they know confirmed, then it's a medically induced pill abortion in that sense.
Sometimes
where
people-
you're still terminating your pregnancy, but you may not know that you're pregnant.
That's
so
true.
if you do go and get this medication, within 1 or 2 days, you would not know.
Yeah.
Right.
You know, you're just taking the medication just to protect yourself.
A preventative measure.
A preventative
Right.
measure. Yes.
But it's still saying you don't want to have the child. You're hoping it works, or you wouldn't take the pill.
Yeah, but there's no fetal heartbeat at that point yet.
Well,
There's
right.
no, because later on there's a fetal heartbeat, and there are doctors here that I have that I can quote that they say that the baby does feel the pain during the abortion, and there's some opposite opinions too, but after the pregnancy and after it goes on, the fetus does feel pain. If you take a morning after pill, there's nothing that's actually has formed yet. Even there may not even be a pregnancy. You're just
Right.
taking
You don't know. You haven't had a confirmation if you do it very shortly after.
Now, what about religious people that are against abortions? Are they allowed to take the pill?
Well, there's the Orthodox and the Catholics they have this thing about you do not, the Orthodox Jewish community and the Catholic community does not allow the abortion, right? But I wonder if it's just the next day. It's
Yeah.
I don't see it
Is it
as
only
a
up to
problem.
certain months that it's healthy to have an abortion?
Well, like I said, for the onset, if you're doing the abortion pill, it's up to 70 days.
No, but I mean,
She's talking about an actual abortion.
Actual,
because I
up to
thought
the
it's
second
not good if
trimester,
it's too
right?
late.
Yeah, the third trimester is what a lot of people have a difference in complications, and a lot of people have emotional and moral, either for or against it, either pro or con. Because
Usually they've decided long before that anyway.
right, I mean everybody has their opinion. Usually in the last trimester, it would need a medical reason for the child or for the mother to get an abortion, varying from state to state.
Correct, yes. So what do you feel about it's a woman's right to choose? What do you feel about that? Do you think a woman has a right to choose abortion, aborting a baby that's already, your 4th month of pregnancy? Do you think that people have a right to
Sometimes they have good reasons for wanting an abortion, financial or health-wise, or years ago it would be a shame if a person had a baby and weren't married,
But nowadays, see, that's the difference. Nowadays, women can have babies, they could raise them by themselves. I know so many single moms,
Yeah.
or even single moms that adopt now.
Yeah,
That aren't married.
same-sex people.
Same-sex people, right.
And unmarried people, too.
Unmarried people, so it's not a shame to have a baby. So why? And then there's a lot of people that can't have children. What about having that child for a couple that have been trying so many years to have a child? What do you think about that?
But you're not obligated. It's not your fault if they can't have a child. I mean, it's your decision.
But it would be a nice thing to
A
do.
lot of things are nice things to do.
What do you think about it, Kim?
Well, I'm My thoughts are, of course, if there's rape or incest involved,
Oh,
that
right.
that pregnancy should not be, a viable pregnancy, because it's
And you would think of that all the time too, probably.
right. I think that you would if that were the case. And again, any health issues, for the mother and for the unborn child. I am for, like I mentioned before, I'm for a waiting period, and I'm for last trimester only in, if there are health reasons that would necessitate to get an abortion.
Right.
I don't believe that abortion should be used as a form of birth control. I believe there's enough birth control out there and a lot of men should take, joint responsibility in birth control. It's not only the woman's decision. And times have changed, as you said, 50%, more than 50%, I think it's like 51% the last time I checked, of pregnancies are to unmarried as well as married.
Oh, really?
So, right.
What about if, let's take the man's point of view, what if the woman wants to terminate the pregnancy and the father of the baby wants the baby? He doesn't want to have the woman terminate. Because remember, it isn't just, when you talk about, it's a woman's, it's her choice, I'm going to put an example, is it really her choice? Because, it's there's a father that's involved too. It isn't just the woman that can make this decision. If the man that, helped create the child wants to have the baby, what do you think about that? Should a woman have the right to, knock off the baby, so to speak?
Yeah, it might be his only child, his only heir. We don't know. I mean, each situation is different. Each case is different. The court case of Planned Parenthood versus Casey, which I don't know if this is a name or not, in which the court decided that an alleged father does in fact not have a right to be notified of the abortion of his former sexual partner's pregnancy. Even though many women discuss the possibility or decision of abortion with their partner or with the child's alleged father, it is not required for them to do so under law. So no matter what he wants or no matter what he says, of course, you don't know until the DNA proves that he is actually the father. I mean, he may think so. As you remember the Anna Nicole Smith case where there were, I think there were 2 or 3 potential fathers, and obviously he's raising the child. In cases where the alleged father wishes to keep the child and the mother wants to terminate the pregnancy, it is possible for the couple to come to a private agreement. So the father would obviously get a family law attorney, and should a pregnant woman wish to terminate a pregnancy against the father's wishes, an attorney has the ability to draft an agreement where the alleged father agrees to pay the medical expenses. She would not be supporting the child, and then in that case, once the child is born, he would gain full and sole custody.
Yeah, because father, even in divorce, it used to be the woman always had got the baby, but there's a lot of new things now coming out as, there's attorneys that are just for father's rights. So the father does have some rights, and if he wants to, say he never was a father before, he's older, and this would be his only child, that would be something that needs to be considered. There's so much, girls, there's so much to talk about on these situations. And also, why wouldn't a woman, if you're, you're with a man, why wouldn't you make sure that if you decide to, have a relationship with a man, why not make sure that you're covered? There's, men have birth control, there's contraception, you can even buy it and keep it. So if a man says, oh, he forgot to buy his contraception, you have contraception there, or you make sure you're on the pill, or that you're covered in some way. Do you think that women are using, a lot of women use abortion as a form of birth control?
I think they most likely probably do, but again, each case is individual, case basis as far as birth control. Some women might be an older mom that didn't think she can get pregnant, and so it could be something like that, or it could also be that that in that instance, birth control is not affordable. It can be very expensive.
But no, I don't think male
To go in on the
condoms
pill, right.
Yeah,
Male
they
condoms,
are
right.
not expensive at all, and those are pretty.
And then we get the macho type of male ego, that he doesn't necessarily want to do that, and maybe they're in a more committed relationship, and they're not worrying about possibly safe sex or not safe sex, and accidents do happen. Yes.
Well, if they're in that type of relationship, then they have to know that a baby can be formed. Yeah. So I think I think people need to take responsibility for themselves. If you don't want children, you have to make, and your partner, as you say, your partner doesn't care. What do you think, Joyce?
Well, under that case, you should, if the husband doesn't care, then you should do what you feel is right, I imagine.
Right.
And also maybe they have a career too, that's another reason. And what about, you said before, the man doesn't have to be told. What if they're married? Do they have to be told?
No, they still don't have to be told. Because even though they're married, it's the alleged father. We don't know.
Yeah, that's true.
Right.
And we were talking a little bit something at the Bluegrass today. You were talking about male, a lot of men have been told after vasectomy that they can reverse that if they ever want to have children. Mm-hmm. And I think, Pam, you mentioned that isn't true. So maybe you could talk a little bit about that.
Well, it depends on obviously the type of procedure done, but you can't look at that as being, to turn back. You can never, as a woman can't either. If a woman has her tubes tied and then, decides that she wants to have more children, something could have happened to that child. Mm-hmm. She ends up in another relationship and wants to have another child or more children. She could be, obviously, even kids, you could have children that, as they get older, they're no longer close to you. Mm-hmm. The relationship is totally changed. So especially if they start off with a new relationship with another spouse, they might want to have another child. But you can't look at that as being reversible.
Right, because we're told a lot of times that, I know that men have been told in the past that by having a vasectomy, not to worry, it's reversible. If a woman has her tubes tied, they can untie them. And it sounds very simple, but but what I'm hearing from you today, it's not a simple procedure. Once in a while it may work, but the majority of time it doesn't work. So if a woman knows that she's going to possibly, not be in a different relationship, or she may want eventually more children, or a man wants more children, they should not do that type of procedure.
Mm-hmm. I heard of a case yesterday of this couple. They have one child, and they wanted 4 altogether. Now she found out she has breast cancer, so she's afraid to have any more children. But people have had children with cancer, I know.
Yeah, and I think if a woman's young enough, it would be good for them to freeze their eggs.
Freeze the eggs, because once they start on chemotherapy, it might, do something to the fertility level.
Oh.
And it might be beneficial at that point to freeze your eggs.
Right.
Right, at a later date.
Mm-hmm. So all of a sudden,
or for the aging millennial who's career-minded and has to finish doctoral students, and who just, as they're getting into their 30s, they might want to think of doing that as well.
Yeah, and people that have been on
also students.
Yeah, people that have been on, or a lot of times people that have been on fertility drugs for so many years have trouble getting pregnant also, because somehow it stops their...
You mean birth control?
Birth control pills, yeah. I'm sorry, birth control pills, and some of them have started in high school on birth control pills, and they've been from high school to college to work situations after college, and then they all of a sudden want to get pregnant and are unable to do so. So maybe that would be, if one has a chance to have their eggs frozen, that would be another idea, so that they need to want to have a baby, they have at least eggs somewhere.
Which is not covered by insurance. It's totally on your own to do that. Right.
Exactly. So how do you think that different states are now going for where they're going to stop having abortions after a certain, do you think the states should be involved, since it was the Supreme Court, this was a Supreme Court decision, but all of a sudden now a lot of states want to reverse this?
Well, they're circumventing the Supreme Court decision. they feel it was a landmark case and that it's not going to be reversed, so they're taking it upon themselves. And then again, it depends on, the people that are in office, the people who are bringing up each bill, and is this something that actually the constituents want, or certain people who are delegating these
Is it a
bills?
political thing?
Yes,
I mean,
that's my question.
Yeah. Is it becoming political? Mm-hmm. Do the people want this? Is it who wants this to be done? Is it women? Is it men?
Yeah,
is it the government? Is it the political? Is it a political party thing? Another political thing. The Democrats against the Republicans. Republicans against the Democrats. What is really going on here?
Well, I think the country is just indicative of the whole country being divided.
One doesn't have to be a resident of another state, do they? You can go anywhere.
No, you can go anywhere. You don't have to take a residency.
Another case would be like a young girl would get pregnant, and then the father would either feel guilty or she'd want him to marry her, and that could be a disastrous marriage. They just got married because of the baby.
The gutshot wedding? The old The father staying there at the doorstep.
No, he feels guilty or something. They're young, they couldn't go to college, this or that, and they just marry her out of guilt or...
Yeah.
Well, I don't think that happens as much now because, we're 2019 and everything has changed. And
yeah.
I think that it's very political. I think this just reflects a state of the union, that it's very
divided.
Very divided.
Yeah.
I mean, we have right wing, we have progressive left, we have liberals. The Democratic Party is starting to get more liberal. Independents. And
libertarian.
And more socialism is coming in to view.
And that's something else that you mentioned is socialism, and I think a lot of people who are kind of like middle of the road on abortion are saying to themselves, I don't want to pay my taxes for, a woman who's going to have 4 or 5 children and can't afford those children.
Right,
so
right.
I think that's coming into play a little bit.
Yeah, because I don't want to be responsible. And then you have the pro-right, the pro-rights, they want for, pro-abortion and the pro and against abortion groups. There's two big groups now, that are there, that are really fighting this. One fighting for abortions, one fighting against abortions. So there's 2 big groups now that are in charge, that are doing this, and they're both. And I guess they're both somewhat political.
Yeah, why did we discussed this before? Why has this come up all of a sudden, such a big issue?
Well, as Pam was saying, there's a divided America right now.
Mm-hmm.
In fact, I just did my last show was on divided America, and this is what's going on. Girls, I know we only have a couple of minutes left, and I just want to just to say that this is our new show called The View from Highland Park. My guest it's not my guest. We are going to be the 3 women that are going to be, each time we come here, we're going to be doing a different show for you.
Probably once a month, right?
We're going to try to do once a month, women's point of view. And I have on one side of me Joyce Bernstein, host of 30 Minutes with Joyce, and Pam Chill Out. And I'm Suzanne Conman, Commons Current Events Roundtable, or just Commons Roundtable. And I think this is a good show because it's all from a woman's point of view. Maybe once we'll have a male guest on our show, so we can also find a male point of view as well. I want to thank our guests here today, and we're not the guests, we're your hosts. All 3 of us are your hosts today. And hopefully, this abortion situation that we have, pro and con, I think is going to be something that is going to be, it's not going to go away. It's going to be with us for a while. There's going to be a lot of, I see demonstrations both ways. What is your point? We have another minute or left.
Well, I see a lot of demonstrations are happening, and the 2 are not going to be coming to